I am presenting to you about what are the common diving injuries that mostly happen. Okay? So, before I share more, allow me to introduce what is DAN. Divers Alert Network, founded in 1980. So we are the world's largest scuba diving safety association. And our mission is one, to help divers in need with emergency medical assistance and promote diving safety through training, research, and education. Now, are you guys divers? Okay? We are divers right here. So we experiencing common injuries, or some of us, or our bodies experiencing common diving injuries. What are the common diving injuries that happens? These common injuries we receive from the emergency medical hotline. So we have the emergency hotline in DAN to receive all the calls from all over the world. Number one is barotrauma. Have you experiencing barotrauma? Yes? Okay. So, before me, Dr. B already explained beautifully and so complete about barotrauma. But the most common is ear squeeze, mask squeeze, sinus barotrauma. That are the common. Okay, so barotrauma. Baro is pressure. Trauma is trauma. So barotrauma is a trauma causing by pressure. So if we are not pressurized, we can't get barotrauma, right? So injury due change in pressure plus enclosed gas space. Because normally the gas space in our body should have a, what do you say? In and out. The air can come and go. So the most common is ear squeeze, because it only actually require a correct technique of equalizing. So what you have to do is just equalize early, equalize frequent, head up position, and control descent. So if you are diving and you are having difficulty in equalizing while your body is already below you, just take your time, don't force it. Your body will wait for you, and you must give sign to your body that you're having problem equalizing. You have to. Do not force yourself, because you will getting ended into more severe symptoms. Okay? So, and then the most important thing is, do not dive when you are congested. Even you have a mild flu, mild cold, because even if you have a mild cold, then you're diving, you are contacting with water that is colder than your body temperature, and that can causing your mucus, your face, your sinus to be more congested. Okay, the other barotrauma that common happen is sinus barotrauma. So if you ever seen your body or yourself having a nosebleed when you are surfacing, that probably a sinus barotrauma. Okay? If you want to know more of the mechanism, we can discuss it later. The next is, of course, decompression illness. Decompression illness encompasses arterial gas embolism and decompression sickness. Are you still confused between DCI and DCS?
Yeah.
Not now, right? Now it's clear that DCI encompasses arterial gas embolism and decompression sickness. So what is arterial gas embolism? This is a really red flag symptoms that we have to really act really fast because this is a really dangerous situation in divers. So AGE typically results from a lung overexpansion injury. I will try to explain slowly. This is our lung, right? And this part is the smallest part of the lung that called alveoli. The alveoli has really a lot of vessels, blood vessels. So this structure can what do you say? Can elastically and if you are having or if you are holding breath and you are doing ascent and while you are holding your breath, this can expand like the balloon that you seen in the analogy of scuba diving. When this is bursting, the air from the alveoli comes into the vessel, comes into the blood vessel, that causing the embolism. And the blood vessel from the lungs goes directly to brain because that is the main vessel in our body. So from lung goes directly to brain. So AGE allows gas from the lungs to enter the bloodstream as small bubbles. If transported to brain, it can cause rapid and dramatic effects like stroke. It's typically like stroke. So we have to act fast, really fast. The primary risk factor is breath holding during ascent. That's why in scuba diving training, this strictly holding breath during ascent. So we breathe normally. We are not exhaling too much. Just we are breathing normally while ascend. Okay? And this can occur as little as 1.2 meters depth. So this is why every influencer, scuba diving instructors always encompass, do not breath, do not hold your breath, do not hold your breath. This is the reason. And sorry, can you help? If you have any question, just give it right or just remind your question. We can discuss it later, okay? So, AGE, I think way before that. Way before that. Okay, stop. Yes. I'm sorry for the technical problem. So what are the signs and symptoms? So typically like stroke, AGE can causing sudden loss of consciousness. So if you are knowing that a diver suddenly unconscious, just please assess and you have to really careful of the first 10 minutes. Okay, stroke-like symptoms. So this is typically like stroke. It can causing paralysis, weakness, numbness, loss of speech, or confusion. And it can be cardiac or respiratory arrest too. And sometimes diver may recover and then deteriorate. This is why we have to monitor really often. We don't want to leave the diver alone and we get help. Someone have to observe and look after the diver. That's AGE. Okay? Now, decompression sickness. Decompression sickness happens a lot in our emergency hotline because we receive calls from the injured divers, and most of the cases are board trauma, DCS, mostly mild, but hopefully we don't have AGE, but we do have AGE. Okay? So decompression sickness. that is a condition that arises due to reduction in pressure. So if you remember the Boyle's law, the balloon, if the balloon goes down, so the volume is smaller, right? And if the balloon is going up, it's expanded. That's what's happened to the inert gas in your tissue. The same. So that's why we want to control our ascent. So that's give the inert gas having a time to get out from our body through our breath. Okay? What are the risk factors? Depth of dive, duration of dive, rate of the ascent, multi-dive, repetitive, and altitude exposure. This is real because I just assist a case, no problem with the dive. She already complete all the dive normally. The day after, she went on altitude and the symptoms started right after that. She already cleared all the surface interval, but she is developing the symptoms in the altitude. And while she is going down into the coastline, the symptoms are gone. So that's probably a DCS due to altitude change.
Okay, good.
So what the sign and symptoms of DCS may vary between 1 and 2 divers because it depends of the amount of bubbles that trapped, the location the bubbles is going to our tissues, and the growth of the bubbles. Like, for example, the altitude. Like, she is completely fine with the diving, but while in altitude, the symptoms starting. And then the severe DCS are if the bubbles get trapped in brain, spinal cord, and inner ear. This is a red flag sign. So beware if you are spotting a sudden red marble patch or skin rash that is migratory or comes and goes after your dive. The symptoms may include pain after your surfacing, numbness, fatigue, nauseous, vertigo, dizziness, motor weakness, and skin rash. But the fact is, most DCS cases starting with unusual fatigue. So the fatigue that comes unusual in your body after you're diving. Because usually when you dive, you're feeling nothing, just regular tired. But all of a sudden you feel like this is not common. This tired is not common. So listen to your body, observe yourself, and get yourself an early oxygen as you can. Later we will talk about oxygen. So now, what are the treatment of the most common diving injuries that we can do in first sight?
Right.
Here is what we know. We do have the oxygen as the first aid kit in our dive center. Administering emergency oxygen is the preferred first aid. There's nothing more than oxygen because we just dive. We are diving with compressed air under pressure. So we want the nitrogen to eliminate as fast as it can. So with what? With oxygen. Okay, but not just oxygen. You have to be in the correct flow and in the correct mask or delivery device. Because this is proven, this has happened in our most cases that it can drastically improve the outcome of the symptoms. So the fastest you recognize the symptoms, the fastest you take the oxygen, and the fastest it can improve your symptoms. So the oxygen is effective. It is 80 to 90% effective when it provided early and the correct flow rate, and until the medical assistant is there. So some depth sensors are just putting the flow rate really slow or really small. We don't want that because that won't help. And this is also proven that some provider wants to put the oxygen in low flow so they can just save a lot of oxygen, but they're not doing anything. So it can be delaying the next treatment, and it can be turning into the severe condition. Provide oxygen as early as possible. So TCS, mostly complaint begin at 6 hours after diving, maybe delay until 24 hours. But we also have lots of cases started right after surfacing or the first hour after surfacing. That's why while you are surfacing, you have to really listen to your body and just feel what's wrong. Is that okay? If everything okay, then okay. But in AGE, or arterial gas embolism, the red flag one, it can immediately happen within 10 or 15 minutes. This is why the 10 and 15 minutes after you are surfacing is a gold standard for you to just look after yourself or look after your body. As a dive professional, you have to take care and look all of your divers after surfacing. This is critical, okay? And AGE may show more dramatic symptoms. And of course, the early treatment that we can do on site is still oxygen, because we want that nitrogen to get rid in our body as soon as possible. Assess the EMS as soon as you are finding any suspicious symptoms from your diver. So, we talk about oxygen, and oxygen. Why is oxygen? Why it's not other gases? Why it's not air? Because we want to accelerate the inert gas in our body. So, air contains of nitrogen and oxygen. How many percent is the nitrogen? How many percent is the nitrogen? 79% of nitrogen. And the oxygen? 21. But which gas that used in our body? Oxygen. So the nitrogen is not used by our body. The nitrogen we don't need that. So that's why we take the oxygen to get rid of the nitrogen. That's why we are using pure oxygen. And oxygen reduces the bubble size and improves the circulation in our blood vessel. And it can increase the oxygen delivery to our system, because we are using the oxygen for metabolism, but we are not using the nitrogen. But in pressured air, we breathe that nitrogen, right? So we want to get rid of that. The primary goal of the emergency oxygen administration is to deliver the highest presentation. So do not ever worry about giving the high concentration of oxygen on land, because that won't be toxic. Okay, a lot of divers asking to us medic, I'm worried if I'm giving the high flow of oxygen, it will be intoxicated. No, there are no oxygen toxicity happens with the high flow, the medical mask, the non-rebreather mask on land, because we want to give it as high percentage as we can. As long as we can, there's no problem. No air brakes. We are not recommending air brakes because oxygen is not toxic in land, but it can be toxic when it's pressurized or underwater. Yeah? Okay. Two key consideration is the type of mask and the flow rate. This I found some dive centers still using the device, the incorrect device to deliver the oxygen, because it can make a different outcome, or it can't make any outcome if we are not using the correct device. I will show you later. And the flow rate. We want the flow rate to be as maximum as we can. We are using that oxygen, so our body will use that oxygen, so there's no problem with that. This type of mask, the nasal cannula, you're familiar with it, right? Do you still see this in the dive operator? Be honest, please. Do you see this mask in the dive operator? Dive operators should not use this anymore, okay? Can we agree on this? Yeah. A nasal cannula. Nasal cannula is, okay, provide insufficient oxygen delivery because it only delivers 24% of oxygen, while we need maximum. We need more than 90% for the DCS symptoms to eliminate the nitrogen from our body. Okay? This mask should not be used to provide emergency oxygen to a diver. If in medical facility, yes, they still use this because medical condition mostly average only need 4 liters per minute or 10 liters per minute. They only need several percent. But we as a diver, we breathe nitrogen and we need the nitrogen to get out really fast. And then there is a non-rebreather mask that is the minimum standard requirement that we hope the dive center provide to you. This mask is really cheap. You can find it almost everywhere, and this is disposable. So this mask can be used in delivering the oxygen. So this is suitable for distressed, injured diver, but still breathing, because we need the diver to be actively breathing. And the variable oxygen can given is 80%. See the difference between the nasal cannula and the non-rebreather mask? The nasal cannula only giving 24%, but this non-rebreather mask can give 80%. This is the goal that we want to achieve, to eliminate the nitrogen. So the next is demand inhalator valve with oronasal mask. Some dive center have this. Okay, this is similar to a scuba second stage. So we have to purge for the oxygen to come out. But this can deliver 95%. But I understand not all dive center have this one. So using a non-rebreather mask still meeting our target. But if you have this is providing better oxygen flow in our body. The next is oronasal mask, the mask that we use to practice CPR. They have an inlet for oxygen, right? And without the oxygen, if we are giving a ventilation blow, it can supply 16%. But with oxygen flow and the mask, it can increase up to 60%. Okay? This is the MTV. So this is for the unresponsive and non-breathing diver. This is the difference between each mask that we are recommend. The oronasal mask, the non-rebreather, the back valve, and the demand valve. And we understand that the standard we meet is non-rebreather is the most standard mask that we can find it easily, and this can give 80% of flow. This enough for eliminating the nitrogen really fast with 15 liters per minute. Do not reduce the flow, please. Please. Okay? So, surface oxygen is first aid, but recompression with oxygen is the standard care of DCS. But not all DCS case needed a hyperbaric, because if they're already improving with oxygen only, they are not needing a hyperbaric facility. So the patient can stay at the dive center and rest, do not dive. So the diver can stay at the boat. And the chamber that available in the nearest incident place may not capable dealing with all case. So that's why you have to let us know, because we can match your need of facility with your case. Because if you go directly to the hospital that you know, you go directly, and then you already spend 1 hour trip, and then the hyperbaric is closed, and then the doctor is not there. So this will be a delay. So that's why you contact us to let us know what is your problem, what is your issue, so we can provide you. This is a case example. I have 2 case example. I will go to the summary because the time is up. The 2 cases, the case 1 is given directly oxygen on site. In less than 1 hour, the symptoms are gone. The instructor gives the oxygen directly. The symptoms are gone and the diver can stay at the boat. But case number 2, we can discuss later. The case number 2, it has delay. It has air breaks. The oxygen continue the next day. And what the result? Delay improvement, relapsing symptoms on the plane. This what happen if we are delaying, we are giving air breaks, we are giving not correct flow, and the patient has to go the hyperbaric twice. Okay, so this is our emergency hotline. So we can talk more about it in our booth. I will be there until tomorrow, so we can discuss about cases, or we can discuss about medical and so on. And if you are in doubt, you can always call Dan for assistance. Dan emergency hotline is not only for Dan members, so everyone can call us in case of emergency. We will assist you. We will assist you to get you into the medical facility as soon as possible. But we cannot arrange the payment for you, but you can always call us. If you have current Dan coverage, tell us. And this is the emergency hotline. If you're diving within Malaysia, you know where to call, and please get some text, because the text has the emergency action plan and the numbers that you can call. So we can discuss this later, and meet me at the booth. And that's all. Thank you.